to start right now. So
Okay.
there's not a lull, right?
There
There
we
you go.
go.
Okay. All right. Well, everybody, thank you for being here and taking your time away from whatever you otherwise would be doing. Uh, and 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 I thank you for your dedication. I've known many of you sitting here already for I don't know 30, 40 years, and here we are still. And I think everybody looks younger than I do, but I've aged a bit. Okay, but I kind of hide away here in my office, so this is coming out for me, see what this guy looks like and if he can still think, right? Okay, so we have some time together. It's going to be kind of controlled to be an hour, and just in respect to everybody's time, and hopefully we'll be able to learn more about Method Orthodontic Suite. Right now, I have in front of you a SmileStream case, and the reason why I have it here is that I'd like to just go through some of the features before we get into Method Orthodontic Suite. So let's. Um, I can't remember how old this woman is, but she spent a lot of money on her mouth, and I think the most descriptive is this panoramic view. And she's got some existing implants. It looks to me like there was a failed implant, possibly, or maybe just a failed tooth here at 4-6, the lower right first molar. And then if I zoom in a little bit, we have it looks like an endoperio type of a problem here on 1-5. I don't know if they are making efforts to keep that tooth. To me, I'm just going to call it hopeless. It has a hopeless prognosis, at least with the information I have, and that's also important when we're thinking about the aligners. And she's requested to have her teeth straightened um, before she does any more. And so you can see the implants that are existing, we consider those to be non-movable, and we do not want to apply the forces to those. Otherwise, maybe we will move it unintentionally and have it fail on us. So we'd like to avoid those teeth where possible. And an aligner, of course, is good for that. You just lock it down and don't apply anything to it, don't move it. But if you're moving adjacent teeth, then it can also feel forces, even though as an anchor tooth, even though it wasn't scheduled to be moved. Um, so we've got two of those. We've got one that looks like it's failing, and we have a lot of porcelain here. We have let's see here. Let's see. Whoops. Did I lose it? I don't know here. I think I hit the wrong button.
We can still see the screen. So we
Oh,
still
you
can, yeah, we can still see your pano.
can. Okay. I'm trying to. There we go. For some reason, I hit the wrong button. So, all right. So let's. All right. So now we're looking at at all of this porcelain that's here, and I ask you one question: are you going to be able to do this with brackets? And brackets are a little bit of a problem when you have all this porcelain and especially things that she spent a lot of money on and things can come off and fracture and it's a problem. So to me, this is a perfect aligner case. In other words, I don't want to be bonding brackets. Yes, it's true. I'm also limited to bonding attachments to this case as well. But it's more of a, okay, let's avoid the posterior. Let's deal with the anterior. And she's, of course, looking at what? She's looking at the rotations. So this case is about rotations. And the reason why I chose this is that to do this with brackets, yes, you could bond just lower 3-3 or 3-4. We have a severely rotated lower left first bicuspid. That's actually about 57 degrees. You'll see here when we get into some of the other screens. And right next to it, we have like a canine that's also severely rotated. And then, of course, what she's seeing is probably not only the canine, but the lateral incisor. And so this is about rotations. On the upper, I don't see so much. I see one um, little rotation here, a rotation possibly on these upper canines, but not so much. Okay, so it's basically the lower anterior that is motivating her to say, I'd like to spend more money on this before investing in more implants or crowns or all the above. Okay. All right. So let's go then into Method Orthodontic Suite. And let's get, let's see, Method Orthodontic Suite. Let's do this one. And I hope you can see this. Can you see this is in Method Orthodontic Suite? Okay, this is the scan that was sent to me, and I want you to see some of the problems I see with the scan. And if you're going to manufacture aligners from this scan, not only in like progressive aligners or in meta aligners, either one, you have to be concerned with the scan and the quality of the scan. So we have some gingival recession, we have some undercuts, and we have, let me show you here. You see this in the scan? That's not the bite. Somehow in this area, this got messed up. Okay, I don't know what this is up here, but you can see that there is a void in tooth 4-3 and overscan or something here on the incisal edge of 4-2 or rotated tooth. And looks like maybe some like depressions. I'm not sure exactly what. I'm not sure if this was taken before the calculus was removed. But is this an acceptable scan for like building an aligner? Well, if I'm going to send this to Method Aligner, which I would do without a designer to clean this up, then maybe what I get back is not going to fit. Okay, so let's go now. I cleaned up a little of this, and I'm going to change over to a different one. Let me see here. Let's see. Euro study, Garrett. Here. Let's go to this one. And this was after I cleaned up the as best as I could. But I didn't want to change the incisal edge, because if I change the incisal edge and I take away too much, then it'd be a problem, right? In other words, now you have the like retainer material contacting prematurely on that incisal edge. I also did not have the ability or know how to do the like depression here on like 4-2 possibly there and on 4-3 here. But I'm going to go ahead and make a simulation and then decide in between doing meted aligner and progressive aligner. So this case is going to contrast the like two approaches that you can take and how you might manage those. Okay, so remember now I've got 3-3, which is the primary concern here, and that could be a limited simulation, a limited simulation. If I include 3-4, then that's more than limited, right? That's including another tooth in the simulation. And then, of course, I have to manage this space that's over here. And am I going to put in a restoration in the simulation? Or how am I going to manage that? Okay. So we've got lots of issues here to deal with besides just straightening the teeth. Which teeth we're going to straighten, how many trays, how long is it going to take this patient to get through it? And so let's go then to meted orthodontic suite. Is everybody following me so far? You kind of understand the case? All right, good. Thank you for nodding your head. Okay, so let's go to meted orthodontic suite for this case. And I have two here. I have two files. One of them is limited. That is a simulation to just straighten the front teeth, 3-3.
Yeah, you're gonna need to share your screen. We're still looking at Medit link. We can't see the MOS sub. So when you hit share screen.
It says I am screen sharing. Okay. Well, anyway, I've got two. So let's see what happens if now do you see the screen?
No, we only see Medit link.
Okay.
So unshare, stop sharing. Now hit share and share your screen.
Okay. Thank you, Miles. Let's see. Maybe this one.
Yep, now we have orthodontic suite.
Okay, now we have orthodontic suite. Okay, thank you. So, so this took me directly to a finished proposed, treatment for this case. So let's back it up. Let's go to the occlusal table as a starting point. Let's see here. I'm trying to show full, no. Now I got the wrong one again. Let's see, view.
We can see perfectly from our side, so you can keep going if you can see.
But I can't see it. I can't see it.
Oh, there you go.
Let's see. Now all I see is you guys. Okay, I lost my.
Darn technology gets you every time.
I know. So
just unshare the screen and reshare the screen, and you should be okay.
Okay. Good, I have you here. Otherwise, we'd be stuck. Let's see. Share. Let's see that one. Yeah, that one. Okay, I'm back. Okay.
Yeah.
Now I can't see because you guys are on top of me here. Let me see. No, I can't do it. Okay. So I can see the occlusal table is just on the very edge here to where the lower incisors will be intruded to the occlusal table. Do you see that? Okay. Now, do I want to adjust that? If I'm looking at the lower right um, side view, on the lower right side, at the very bottom right of your screen, you can see that the third molar is above the occlusal table. The lower incisors are slightly above the occlusal table. Now, if I go on the left side over here and I add to this view the upper, then you can also see I've sort of split the difference there vertically. So leveling will be to the occlusal table with some movement upper and lower, but it's not all upper or not all lower. Okay? So that's how I did the simulation on this. I don't recall exactly if that's where the dots put it, but that's where I adjusted it to. And so the programming of the aligner is dependent on the occlusal table, how you position it. You get that? So, and I can change that position. I'm not going to do it because that'll change everything going forward. If I just right click on this lower right issue, on this lower right view, then I can rotate it clockwise or counterclockwise. Okay, but I'm not going to do it. Then I went to tooth ID. There we go. And you can see this?
Yep.
You see tooth ID? Okay.
We got
so
you.
The first thing I do on tooth ID is I look at the numbers. And you can see here I did not paint 4-8. I did paint this one over here. There is no reason to. The upper is not in contact with that. I'm not really going to be leveling that lower third molar for any purpose. It's going to just mess up my mechanics actually of what's going on. So again, I'm focusing more on the anterior teeth, not the posterior teeth that are full of porcelain and implants and everything I don't want to mess with. Okay. So I've also not painted anything on 2-8, 3-8, 4-8. Now 4-6, I don't have anything here. 4-6, I probably should, but I'm not going to because I want to teach you something here. I could probably put in a planned prosthesis, and if I do that, it would make a mirror image of 3-6, and it would put 3-6 over in the 4-6 position. You understand that? Since I have the same molar on the opposite side, it'll copy that molar, flip it around, and put it exactly that same size, mesial distal width, buccolingual, the whole thing on 4-6. I guess I could do that, but that's what would happen. I actually think it's more dramatic if I don't put something here, because in simulation 1.1 level and align, the molars are not allowed to move forward or back. They can go sideways, buccolingual, but they're not allowed to go forward back. Okay, so what's going to happen with that space is it's going to close that space, creating a big overjet if I do not put it on there. But I'm not going to put it on there because I want you to see something, another way to manage this. Okay, no growth, of course. That's also in this window. So let's go on to the next one. Self tracing. I think all of you have experienced this, right? AI chooses all the points for you. You just have to click on here to get the dots. The red dots are the most important, and you can edit those. Here on this one, the molars, the most important thing about the molars is the widths. And in this programming, I made distinctions of dental compensations based on the widths. So if the width is greater than 3 millimeters or less than -3, then the incisors have to compensate for the skeletal class 2 or skeletal class 3. I'll say that in a skeletal class 2, the upper incisor will be more retroclined, the lower incisor will be more proclined. More retroclined and proclined than what? Well, from the McGann ideal, since I programmed the angulations for the setup for ideal, then relative to that inclination, the upper incisor will procline 4 degrees. If it's just a little bit, if it's over 3, or 8 degrees more proclined in a class 3 case. In a class 2 case, again, it's -4 or -8. Okay? And then the lower incisor, +4, +8, or -4, -8. Okay, do you understand that, the dental compensation? Or do you want me to spend more time on that?
I just want to put a question on that, because does it depend on the amount of the class 2, how much it proclines or reclines, or does it depend on whether I choose moderate or maximum compensation?
When you have a set, if it reads, in this case, this would be, if anything, a class 2 case, right? I don't think it's going to be over +3 widths, but it could be. I haven't seen it. I don't remember. But if it's more than a class 3 skeletal, class 2 skeletal, widths of say +4 or +5, then it's going to retrocline the upper incisor 4 degrees versus ideal, and it's going to procline the lower by 4 degrees. So that would be one step of dental compensation to the skeletal class 2.
Okay.
If your skeletal class 2 width is a +6 or greater, that's a pretty severe one, then the upper is retroclined another 4 degrees, the lower is proclined another 4 degrees. Total 8 in each direction. Okay?
Okay.
All right, so
and what is the effect in the later on? I can change between maximum or moderate compensation.
Yeah,
what is the effect then?
It's the same effect.
It's the same effect. That means it makes it automatically, but I can overrule it.
That's right.
Correct.
Okay.
Or if you don't have the supplementary X-ray, then you can still add it.
Right.
Okay. Perfect.
Okay. So
Yeah.
if you don't like the inclinations, then you can change it later. Okay.
Perfect.
All right, so let's now measure. That's the next screen, and I can't read. What does it say here for skeletal for the widths?
2.5.
2.5. Okay, so 2.5, we're good. We're going to get ideal inclinations on the upper and lower incisors, unless we want to modify it, and then we can do that manually later. You understand that? So it's a skeletal class 1, and that's when you can use ideal inclinations. To put it another way, LI 1925 upper and SLA 1925 lower. Ideal inclinations is only possible when you have skeletal class 1. If you have skeletal class 2, then you have to have a more retroclined upper incisor and a more proclined lower incisor. And also, just as important, the end result will show you an ideal overjet with some class 2 in the posterior, 1 to 2 millimeters or so. And this program shows you that. It shows you what the end's going to be like. Okay? All right. I know that the dental compensation concept is complicated. In a surgery case, I know you know the words decompensate the incisors. That means put them at ideal inclinations and then move the jaws. And then everything fits. Okay? All right, so let's go to the next one. The next one will, oh, by the way, this is just to also to calibrate the ceph versus the scan. So if it's not fitting right, you put like one dot on the incisor of the model and the ceph, and then one dot. Do you want me to do that? I don't want to change anything right now, so let's just keep. Okay, I can change things if you want to see me change these things. I'll be happy to do that, but not right now. I want you to see where we are. So here, of course, I'm going to check not only symmetry, but the arch form to maintain has been chosen. In this case, medium ovoid. And especially if we're doing limited treatment, we don't want to change the arch form. And especially if we have posterior teeth that are implants, we don't want to be changing their movement either. Okay? Is everybody in agreement of that? So if I go up here and I say, well, no, I want a bigger smile, am I moving the implant? Yeah, here's the implant right here. I'm moving the implant. I'm expanding the implant now. So one of the negatives about treating a case like this with brackets is that the arch form is limited to our 10 IP arch forms, and somebody else treating it, they'd be limited to probably their one arch form that they're using. Does everybody understand that? Now, in the Medit aligner, or also we have little areas that we can alter that arch form. So if we wanted to constrict maybe right where that implant is, we have the ability to do that. Okay. So I'm going to go back here to medium ovoid. And that might be a little bit constricted right there on that implant. Now, we now see another issue. So we're going to be comparing limited treatment versus comprehensive treatment. I already mentioned the lower bicuspid as being part of a comprehensive treatment versus just straightening 3 to 3. That's a limited treatment. In comprehensive treatment, we would also, this upper right molar is also rotated. So in comprehensive treatment, we would rotate the upper molar. Where in limited treatment, we're just doing 3 to 3. Okay? So you have to decide what your goals are. What are you going to accept? What is the patient asking for? How can we get through this case without disturbing the whole thing that she spent so much money on so far and have to be dealing with, oh gosh, you know, this little veneer fell off or broke or something like that, okay, during the treatment. Okay, so let's keep going. Now the AI chooses the molar, and I don't know if I edited this or not. If there's no molar, it goes to the cuspid, okay? And if this is within 1 millimeter, class 3 or class 2, then it changes the bite classification down here automatically, after plus or minus 1. So right now it's reading class 1. If we're doing this type of a treatment, we do not want to be applying mechanics here, looking at a 0.5 millimeter or class 2 or class 3. We just want to straighten the teeth, get in, get out, do your restorative, whatever you're planning. Okay? So you have a choice of you could do it off the bicuspid if you want. You just have to move these little lines, okay? And how you move it will determine what simulations you're going to have choices of in the next window when you're choosing simulations. Okay, so let's go to that window. Here is simulation 1.1. With ideal inclination, right? Wait a minute. What's all this overjet? Well, that's because I did not place a molar in there. Now, if I wanted to do comprehensive treatment, then I need to put a molar there. Where? Back here on the tooth ID. But in simulation 1.1, it closed that space, creating the overjet. But if I choose a limited option, limited anterior only, 1.1.1, to straighten the teeth, no IPR, look what happens with the overjet. Now it doesn't care that there's a space there. So one of the differences between comprehensive and limited is that in the limited simulations, you don't move the back teeth at all. You're just moving the anterior teeth. Okay? Is that what we want to do in this case? Just move the anterior teeth? Okay, well, let's look and see if that's what we want. Okay, so I've got maybe a little too much here on the too much inclination here. And Collins likes to kind of do all this in the next step, which would be like adjusting the manufacturer your tooth movement tools. Because those didn't come for such a long time, I got used to doing tooth orientation. So I'm going to do tooth orientation of this lower lateral incisor. That is one of our key teeth, right? We have to fix that. Otherwise, she's not going to be happy. So it automatically goes to rotation, and it says, I'm identifying this tooth with this line. That's what the AI did. And I said, but wait a minute, that's not rotated enough. So I need to move this line so I can correct the rotation. In other words, I'm helping out the AI identify a tooth that has a bad scan. Are you there? Are you following me? Okay. So now let's go look at that. Oh, okay. What about this cuspid? What's going on here? That looks okay. But this is all just relative. And wait a minute. I got a straight 3-4. You see this? It's giving me options to move any of these teeth.
But being that you're not actually doing that the limited, then it's up to you if you're going to treat this comprehensive or not.
Right. So now I'm in, if I'm going all the way back on that, I'm going into comprehensive. So it's telling me, is this the way you want it identified? And I go, well, not really. I saw too much space over here. And so I could adjust maybe the lower canine to move the root a little bit that way. So let's see what we get with that. So we check the check mark and let's see what it looks like now. Huh. Okay, that doesn't look any better. That looks worse, if anything, right? Okay, so I got to go back and go, wait a minute here. Actually, this tooth is actually very difficult to identify. So I guess I'm going to have to leave that gap there. I went back and forth on this tooth. It
You
does
got
not.
Dad, you got 2.3. You might want to click a different one and come back to 1.1 because you've got the beta version. That's why it might not be moving. So click on 1.12 and see if it identifies it differently.
Really? Oh, okay.
Because it'll sometimes freeze up and not move because you've got a beta version. See, now it's identifying it better.
I didn't realize that. Okay.
So
All
now
right.
go back. Now go back to your. Now go back to your 1.1.1 and it'll be better now.
Really?
Or 1.1.1 is what you were working with.
Yeah, that's better already.
Right.
Okay. Yeah, I am working with a test version here.
He's got 2.3. You guys don't have that one. So you guys don't have these same problems.
2.3.1. So that's scheduled to come out in April. And good thing we're finding these things now, so you won't have to deal with it. Okay. So I had to go back and forth to get this that way. I'll do the rest of it in the tools. Okay. So right now we want to go away.
That's doing a weird one still. Oh, okay.
See if any of them. Okay. Well, I can always do it in the tooth movement tools, and part of it is probably the calculus here.
Yeah.
You see the calculus here on this side on the lingual that wasn't cleaned off, and it's in contact down at the gingival there. So if I go back and then clean that up, then the space may go away. But I was looking better before I started messing with this on the one that I had done. Okay, so
Why my warning goes down to be careful with that tool he just used.
right,
It's a tricky one. Only use it when you feel like you have to.
right. Okay, so 1 point, this is IPR on the upper, 1.1.3 is IPR on the lower. Okay. And what's that looking at? That's looking at the overjet. Okay. So if I go no IPR 1.1, then I have different overjet than if I do IPR in one or the other. That makes sense to you, right? Okay. Now let's do this. Let's do this compensation. You can see how much overjet there is there. Let's change that instead of class 1, giving us on the Ceph, giving us ideal tooth inclinations. Let's do a class 2 moderate dental compensation. And you saw a little blip there. It didn't really do very much. Okay, so let's do it again. Let's do maximum this time. It's not that much, people. It's not that much. It is retroclining. If we look at the upper incisor, you see how the upper incisor is now more proclined. It's only 4 degrees. It's not a giant amount. Okay. Okay. So let's now we have more tools though that we can adjust that if we want. If we just click on next and say, I want to modify this with the tools, 3D editing tools for this case. Now, I'm doing this for the purpose of manufacturing. For the purpose of manufacturing, okay? So it for the purpose of diagnosis, I don't really have to go to this much detail. Now, I could just right now, I could say, you know what? I don't want to deal with these tools, order it, and let me just do a few of these trays. You say, well, wait a minute, look at all these 30 trays, 30 trays for 1.1, that's on the lower. Well, that's an awful lot of movement, right? So let's look and see here. There's only 13 trays on the upper, but I'm paying by tray here. So let's look at the main event. The main event is in the lower. So let's look at the lower. Let's see where these 30 trays are. Well, it isn't this it isn't the rotated bicuspid. It's got to be from 3 to 3 here, right? Okay, so where is it? Well, if you click on treatment refinement, you're going to get a hint. You can do bolt analysis, superimposition, tooth movement data. If I look at, you see all these zeros? That means it's not moving those teeth. So if I look in here and I look for big numbers, I say, well, wait a minute, where's the biggest number here? Got to be in the rotations.
You're on the upper.
Oh, thank you. Lower. Here it is. So here it is, 40 degrees on tooth 4-2. Remember the one that was rotated so much? So that tooth is costing us trays. Each tray is scheduled at a certain rate of tooth movement, and if it has to rotate at 40 degrees, well, it's going to cost you. Okay, that severe rotation is going to cost you, and how's it going to cost you? In more trays. That's how. Okay, that you have to buy to straighten that teeth. If you're going to do it using metal aligners. Okay? In other words, buy by the tray. You're going to just pay by the tray. Okay, so I've got a 40-degree rotation here that is causing me to buy a bunch of trays. So what I'm going to do, not rotate that tooth? No, I have to rotate that tooth. All right, so remember when I told you that, whoops, that's not what I wanted. Remember when, so then you can click on this and it shows you how much tooth movement is there. If I click outside here in the gray area with my left click, it takes me back to the beginning and it shows you how the teeth move. Now, another way of doing it is superimposition, and you can see the start and the end. Okay, you get that? And that's what's taking all those trays to correct. All right, so let me go back for just a minute. 30 trays, and at what rate of tooth movement? Well, if I click on this little wheel, a cog wheel, it tells me that in the mandible, the degree of rotation is 2 degrees per tray. So if I'm going at 40 degrees, well, I need 20 trays. Well, how come I got 30? Well, it must be something here. Other than that, probably moving in the distance is moving too far, or it's moving the roots or something. There's got to be something besides just the rotation, because that would be 20 trays. Now I can adjust this, and if I adjust the mandible degree of rotation, let's say to 3 degrees per tray, do you think I could do that on this adult? That means every time that she changes a tray, it's tighter. And maybe she can't seat it all the way. So what determines how the rate of tooth movement in aligners? It's the periodontal ligament width. Periodontal ligament width is thought to be 0.25 millimeters. And if you exceed that, then you're just like squishing the tooth against the bone and you're smashing it, okay? Kind of like if you put in you try to rotate teeth with a stainless steel wire, it's ineffective, okay? Because you can't get, it's too much force and all you're doing is causing a bunch of pain. So that's the reason for the 2 degrees. But if I say, yeah, go at 3 degrees. Oh, sorry, this is, it stayed the same. That's one of the bugs in the, or not a bug, I guess. It's just, it doesn't recalculate. So now I'm down to 23 trays. All right, so let's go back to 2.1, 2. And it's back to 30. So that's my tooth. So do I want to rotate it or not? I think I got to rotate it. Okay. All right. So now let's go back into, let's make it look a little better. Okay. Let's make it look a little better. So now we're going to go into tooth movement. And I don't think I can move that away. I've got to figure out how to get rid of this. Oh, I did it again. Stop share. I see your pictures along the right-hand column.
You can click the little buttons above there and it'll make it, you can make it so you don't see any of us if you want. But anyway, just share your screen again.
Yeah, let me go back to share. Okay, which button do I have to choose? Let's see.
Don, choose the one, there's like a grid, and then there's 2, and then there's 1 block, and then there's a little small line. Click on the little small line and all the pictures go away.
Ah, thank you. Thank you. Who was that, Collins?
Yeah.
Okay. So now what I want to do is I want to make this look a little bit better. And then decide whether or not I want 30 trays or whether or not I want, and keep in mind that's without rotating this bicuspid, and it's without rotating the upper molar that I told you about, the second molar. So let's go ahead and click on this tooth, and let's see if we can't make it look a little better. Did that make it look better? Yeah, but now I got a big gap there and I got a big space. Okay, so let's go like that, and then let's see if we can straighten it up. Oh, by the way, you do not yet have these little lines. What you do is you go over here and click on angulation, and then you can change the angulation there. Did everybody see that? Or I can move it like so to change the angulation. And then if I want to go up or down, I can do that. Okay, they say, wait a minute, that looks good there, but what about this big space? Well, if I click on edit spacing or IPR and I click on that, it undoes that immediately. I don't have to use little arrows and tooth movements. And so already that looks better. Okay, to me anyway. Probably have a little rotation over here. Now you say, well, wait a minute. Maybe I do want to to rotate just those first bicuspids there. I want to include those in it. So let me look now. Let's see how many trays we have. Make sure it's still 30. I'm not sure if it should be. $29. Okay, so I made this one tooth look better at 29. 29 trays. And what if I decide I want to, and on the upper is only 13. And if I want to order this, how am I going to order it? So let's order this. Let's decide we're just doing 3 to 3 for the moment. Then we could come back and do those bicuspids. That would be a more comprehensive treatment. And since this is already 57, I told you, it's going to increase your tray. So let's see where we are on ordering. And with Colin, since I know he's here now, he uses golf, okay? And do I need to have every last detail on this first set of trays or not? No, you're just taking a swing, getting it down the fairway, getting it to move the right direction, and then we're going to decide how many trays are we going to order. Right now we have ordering meta aligners as an option, export the files, that's if you have a 3D printer, or you want to save and exit. So before we buy, let's decide when we want to, how much we want to order. So we're going to do it right here. We're going to do some tooth movement. And 2, 3, 4, 5. Now you can see the incisors are going forward. Spaces are being created between the teeth. Now this tooth starts to rotate. In other words, there's no sense rotating it until you have some space. And some of the companies, I'm convinced, don't do that. They just start rotating teeth even though there's no space at all. And then you get loss of tracking. Okay. So here it starts again. This is the way it's been programming. And so I've got my space to rotate probably at about somewhere around 8 to 9, right in there. So if I order 10 aligners, I'm not only straightening the upper teeth, but I've got maybe 3. I could go up to 13. Let's go to 13. And I've got some rotation to where the patient would say, yeah, I see a noticeable difference. And then you rescan. So somewhere I would say between 8 at the earliest and 13 at the latest, that's what I would order. No reason to order all 29 trays. Because not only do I have a scan that is somewhat defective, but now I can see the tooth structures better. I've done the like preparatory part to the alignment stage. Okay, so you stop right there and you say, okay, let's do 10 just for easy figuring. Let's do 10. We'll rescan at 10. We'll still have some little like refining maybe to do on the upper, and we'll have a lot to do on the lower. Say, well, okay, then maybe I will rescan again at 20. Let's see what 20 looks like. 20 looks like the tooth is almost fully rotated. So let's go 10, 20, and then maybe just finishing. So what is this one? We don't have any mechanics, so I can't call it alignment, mechanics, and finishing, but that is pretty much the way that the golf works. You hit it down the fairway, you chip it onto the green on a 3-par, and then you putt it in. Okay, alignment, mechanics, and then finishing. Okay, so let's order 10. There's no reason to order 29.
Hey, Don, can I make a little suggestion real quick?
Please.
Just two things on order in this case. The first one is, you remember I guess it's the 4-8, that the lower right side, the wisdom tooth there. If we want to make sure that that gets some coverage with the aligner, like here it does show that I'm just not sure what it would look like if we sent this off to Meted aligners with, you see how it kind of ignores that as a tooth. Um, a tooth that you were going to be, like you didn't paint that one in tooth identification. If I was going to be making aligners off this, I probably would identify that tooth, but then I would just make sure that even if I was doing a full mouth treatment, like instead of just the limited, you can still go always take that one tooth and you can click it in this tooth refinement setting and you can set it back to its original position. But at least that way, the software is considering it a tooth so that it makes sure that it's getting covered with an aligner. So that's just one thought on that. The other thought is sometimes on the staging, when you do have the rotations, you were talking about, why is it giving us so many stages? And what I found is when you're limiting the treatment to 3 to 3 and you do have a decent rotation, it takes a lot more work to open up the spaces that it needs to fix the rotation. So it does spend a lot of aligners trying to open up spaces before it fixes the rotation and then close up all the spaces again. So sometimes I'll take the 4s and sometimes even the 5s. And even though I selected simulation 1.11, I will in this treatment refinement stage, I'll go in and take those 4s, upper and lower, or sometimes even the 5s, and I'll just tip them to the buckle a little bit. And by just tipping them to the buckle a little bit, like you don't have to fix the rotations or do any other alignment, but just tip them a little bit to the buckle. And that actually usually makes the treatment look better anyway. And it's crazy how just giving it a little bit of freedom to move those bicuspids out rather than making them stay in that final position where they don't move at all, it improves the staging sometimes a lot. So if I go and take those bicuspids and tip them out to the buckle, just a couple clicks even, just procline them or bodily move them out. Like what I like to do is actually go down, at the very bottom of the movement control tool, you have those different teeth. I like to click to where it's the apex, like lock down the apex, and then just go up one tool on the tooth movement control, because here you're moving freely. But if you go to the inclination, which is the very bottom tool, yeah, click that one, and then just give it a couple clicks to the buckle. It gives you just a little bit more space. And then when you recalculate it, for some reason, when it gives it the ability to move it out a little bit to the buckle, it really improves the staging in my experience. So those are just two thoughts I had. I agree with everything you've said on this case. Those are just two thoughts that I've played around with as far as like making sure that the 8 is included in the simulation, but then also just freeing up a little bit of space by tipping those out to the buckle will sometimes cut your number of aligners down and kind of help with that initial staging. Because I agree with you in this case where, you're going to want to rescan anyway. So let's go ahead and do the easy movements, which is just kind of open the case up a little bit. And even if you were to go ahead and leave a little bit of space on this first swing, where you don't close all the spaces, you just tip it out to the buckle a little bit and leave a little bit of space. It's going to help that initial 10 to 12 aligner stages do that initial alignment. And then in your next phase of aligners, you can always make sure that any spaces are closed up and everything is the way you want it. But this staging, this automatic staging is very space hungry. It wants space because the more that it has room to move, the better the movements are staged. And when we keep it very tight and we don't give it very much room, like I noticed this when I go and do I don't want any teeth to move. I just want this one tooth to rotate a little bit, like very limited to treatment. It ends up doing all kinds of gyrations to try to get that one tooth to where I want it. Because I'm not letting anything else move. And so for the automatic staging, it really likes the teeth that move out to the buckle. And so sometimes just giving a little tap to the buckle on a few of the teeth really improves the staging when you go back and look at it. And you're like, now I like how it's moving for these first 10 to 12 aligners. I feel better about the way everything's moving here. And then, you might find that that's a little tip to just get things moving the way you want it to. So anyway, I've really enjoyed your presentation. Those were just a couple of comments that I would add from having played with the software and the staging a lot as well.
Good, thank you. Thank you. And he's an expert, believe me, an expert. So let's just order this, and then I will tell you what I will show you what actually happened. And we're running out of time here, although I did start late, so my alarm is over. So let's order this. So do we want to order the maxilla? We want to order the first 10 trays. Well, I'm going to change that. And then we're going to order the mandible, the first 10 trays, right? Total of 20 trays. It's a new patient. I want a box. Include attachments. I didn't do attachments. I should have done attachments. The attachments I would put on this is especially the little like pressure attachments, they call them. In my progressive aligners, it's like rotation or torque. Okay, those, and then we'd like, if we have any attachments, not the pressure ones, but if we have any attachments, we need a template. And then afterwards, I don't want any retainers. I don't want any passives. So let's just confirm this just so you can get an idea. And I'll just put in something fake here. And then let's see what happens. On our first swing down the fairway. Just get everything spaced out, some rotation correction, and then we're going to change it to the next swing. Okay, so that's going to be $390. That's actually the same as euros. So that would be 390 euros with a limit for any individual case of 1190. So all you got to do for, you order as you go, and you may decide that you're finished on the upper and you just order lowers, and you order a retainer for the upper. It gives you the opportunity to do any of the above. If I click pay, it's not going to make me pay because it doesn't have my information in there. But that's the idea. Okay, so you understand? So we're only taking the first $390 cost to us. It enables the patient to do the work, and then we're going to order that with a progressive aligners. Now, I need to switch the screen. Actually, I'm going to go to the next screen to that progressive aligners. And Dr. Garrett decided that he wanted to do a more comprehensive case treatment, including whatever, because he felt that that's what she would want. And so we set this up in like progressive aligners, same case. Okay, so let's now share screen. And you're going to see what happened on the comprehensive. Now, 33 trays. You say, wait a minute, that's more than the other one. No, it's not. It actually turned out to be 32 if I straightened 3-4, because that is a 57 degree rotation. And I am also like rotating, I think it was like 1-7 that was rotated. That's a 25 degree rotation. This one has the little ponic in it. So this was the treatment decision right here. So this is our comprehensive treatment. And let me just look and see. I think I did one little shot here where I overcorrected the rotation. Actually, I like to do, oh, it's not back yet. I see. It's being ordered. Okay. I would like to go usually to 3D, and I can flip back and forth. Here I'd have to go from here to see how much I rotated for 37-degree rotation. So there was a little overcorrection. I usually go in and put a little overcorrection in all these cases, just like in the IP appliance on rotation, 4 degrees difference in a rotation bracket gives you straight. Okay, it doesn't overcorrect. I would say in the aligners, with me put it in overcorrections, 1% of the cases do I actually see some overcorrection, and that's probably just 1% of the cases that wear it absolutely perfectly. The rest of the 99% are going to miss a day here or there and, you know, take it out for an event or something like that. Okay. So you have to add some overcorrection for all appliances, including the fixed appliance. Otherwise, you'll have undercorrection of rotations, as we saw with the Roth appliance. Okay, well, I think that I have covered what I wanted to cover on this case. This was about I don't see you anymore. Okay, I'll believe you're there. Okay, so how come I don't?
Just stop sharing and you'll be able to see everyone, Dad.
Oh, okay, there you go. That's good. Now that feels better. Okay, not just looking at some screen. Okay, so this case was about 1, rotations, 2, limited treatment, 3 to 3 versus comprehensive treatment. Roger, there you are. This was recorded, so you can go back and you can pick up all the earlier comments. I don't know when you got here. Thank you for your dedication of taking a pause in your practice. That's Roger there. Okay, so it was about rotations. It was about existing implants and porcelain choosing aligners instead of brackets. Now, one last little thing that I didn't say. In a meted aligner, at the moment, we don't have scalloped. We have a straight trim line. And with a straight trim line, you need less attachments. So I was tempted to just go with no attachments on this case. And you saw there was only a couple of teeth that they put an attachment on in the progressive aligners because there's only so much enamel, and you know, you have to have enamel also to bond your attachment. Otherwise, some of you are really good at bonding to porcelain, but I never was. They just fall off, you know. Well, they would fall off more frequently. So I've got people that actually bond to zirconium, and you know, brackets to zirconium. I go, okay, better than I am. All right, so so you could go. You saw that the rotation was sort of minimal until like stage 8 or 10, and then it started to rotate. So do you need attachments on that tooth during that whole time? And then you can on the next swing of say 10 trays, you can add an attachment or add just rotation ridges. And by then in April, we're promised we're going to have like scalloped trim line. But the only problem with which sort of scared me a little bit was the like depression error in the scan. And on 4 or 3, I guess it was, the lower cuspid, there was that noticeable depression. And they filled that in at a progressive aligners. I don't think I showed that to you, but they did fill it in. And I was a little worried about that, just sending it off, getting a full all the way down to 2 millimeters on the tissue, and you can't get it into that depression, and you have to get the scissors out and trim it back. So we're not certain exactly. We used to have block undercuts, and all of a sudden on our new software here, that doesn't seem to be there. So either automatically doing it or I don't know what. So I was a little worried about that. But it comes down to comprehensive treatment or limited treatment. And there'll be reasons for both. And Roger chose comprehensive.
Sure.
Okay. All right. In 2 weeks, we'll do it again. We'll have another case. Actually, that was the case I didn't get to. I had a backup just in case I finished this quick, but obviously I didn't finish it quick. Don McGann, thank you all for
Great, Don. Thank you very much.
Time, and hopefully you learned something here that you can apply to your cases.
Yeah, indeed. Thank you so much. See you in 2 weeks.
See you in 2
Bye.
weeks.